Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush.
Hello, everybody. Welcome once again to our podcast. I think we're up to about 95, 96 now. How you doing, Mark?
I'm doing fine, sir. We're supposed to get 2 to 4 inches of snow after April 1st. So.
Oh, dang. That reminds me. I ran out of sunscreen.
Yeah, I know, right.
It's 85 here.
Right, to get some sunscreen. So, that's all right. It'll be in the 60s later on in the week.
Boy, yeah.
Yep.
Well, we just our last couple of podcasts where we were talking about how to promote specific niches like implants and implants. I think it was the last one we did. So we're going to take a look at another niche here, sleep apnea, and deal with that. We had our good buddy Kent Smith on not too long ago, and we talked about sleep apnea and how to what his experiences were in treating it in his practice. And so we thought we'd talk about how to promote it in this one. Is that okay?
Yeah, that sounds good. Yeah, Ken is a really cool story. When did we started working with Ken, I think, a dozen years ago. But anyway.
2005, I believe.
Yeah, okay, about a dozen years. And he still knew what a handpiece was back then.
Yeah.
You know what I mean? He still knew what suction was. He knew what all that stuff was, back a dozen years ago. And then he still does a ton of 6-month smiles and the sleep apnea. And I've said all along, Kent Smith, he should have been a surgeon, or he should have been, because he really loves the whole aspect of, the possibility that you're actually saving someone's life, from the work that you do. He's that kind of guy, right? So, over time, obviously this didn't happen immediately. That's kind of insane. So I think the first thing that you realize if you're going to promote sleep apnea to the dental consumer is that, if you want to try to be like Kent, it's going to take a while. So I think that's the first lesson that you can learn on this podcast. Nothing happens overnight. In particular to sleep apnea, there are many emotional triggers within the advertising. We'll talk about the media types, but like Howie to talk a little bit about the emotional triggers that we use to gain the initial interest. Because it really doesn't have anything to do with sleep apnea, does it?
No, actually.
Right.
It has to do with marital discord. How's that?
That's right. And it works really well.
How do I get my stupid husband to quit snoring?
Yeah, exactly. That's the conversation starter, right? That's the consistent market reality is that if you're a male and you're 45 to 50 years old, if you didn't snore before, you're going to start sooner or later, right? Maybe there's some guys that don't snore, and maybe there's some women that don't snore. But sooner or later, as you age, you're going to start to be annoying to those who sleep around you. Let's just put it that way.
Yeah.
And some of them are worse than others. And the worst snorers can be, not always, but certainly can be an indication of a deeper underlying problem. And so it's that emotional trigger that we use in whatever media type we're in. We'll go through the media types, but whatever media type we're in, that's typically the emotional trigger it's kind of like, they make spoofs out of ads. I'm sure you've heard them. You'll get an actor come on a video and go, "Do you breathe at night? Well, if you breathe at night, you might have blah, blah, blah." You know what I mean? Like,
Right.
When you're driving your car, are your eyes open? If your eyes are open, you might have blah, blah, blah. Right. So it's kind of a little bit of a spoof on advertising, but it's very effective. Okay. So, people listen to these podcasts to try and skip all the bad steps, right? I mean, we've already bought and paid for them, so you might as well skip them right along. And that's one of the ones that we ran into. It's not necessarily to stop snoring, but it's to get the eval done, right? Because with sleep apnea, there's multiple steps, right, Howie?
Right. And you're going to have to form an alliance with a sleep physician. You have to be careful. You're not diagnosing anything. It's the sleep physician that diagnoses. But you take a course and you learn all of these things, and you'll know how to ramp up on it.
Right.
But then we can get into. I remember Kent coming to us and saying, "This is all I want to do." Okay,
right.
So from that point, and the marketing that we built for him and deployed, I think it was probably a year before he, maybe even longer, Mark, I don't remember, but before he was able to ditch the handpiece.
I know. I think it was that, and 6 months miles, I think was probably 3 years.
Oh, was it? Okay. Yeah. That would make more sense.
Yeah.
But anyway, we can discuss some of the media types that we used, or the methods that we used to promote this. In fact, why don't we do that when we get back from a short break? Is that okay?
You got it.
All right. Don't go anywhere. We'll be right back.
Hey, Mark, how would our audience find out about getting more good reviews?
Well, first step is to understand it. There's minefields in the dental business right now. So let me give you the 4 keys. 1, has to be simple for your staff. They can actually call in sick and it'll still work. 2, it has to be ridiculously simple for your patients to leave Google reviews. 3, it has to be able to separate out the not so good reviews from the great reviews and only send the great reviewers over to your Google, Facebook, or Yelp. And 4, and this is probably the most important, only send reviews to platforms where your reviews cannot be taken away. If anybody has any questions about this, it's called NPI Crusader. You can just send Howie and I an email, or actually you can log on to newpatientsinc.com and you can schedule your very own appointment to see it in an online meeting that usually takes 15 to 20 minutes. So most people do it over a lunchtime.
All right. Welcome back. We're talking about promoting a niche called sleep apnea and the recognition of it, and how to promote it and get more of these type patients into your practice.
Yeah, and then the first emotional trigger point was, does your partner or your spouse snore? Maybe a sign of an underlying issue, blah, blah, blah. And you get quite the volume of responses. You also get quite a number of responses from people who are already diagnosed with sleep apnea who hate their CPAP.
That's the other one. I knew we were missing one. The other emotional thing. Hey, do you hate your CPAP? I mean,
if you were in a seminar with people who had a CPAP and you said, "How many people love your CPAP?" No hands would go up, right? There's another consumer consistent. Nobody likes their CPAP.
Yeah. And
so,
because go ahead. I'm sorry.
No. Go ahead, Hallie. Go.
I was going to say, because normally with our regular clients, we don't deploy postcards too often because we are targeting the top half of the dental market, and there's really only room on most postcards to to target the bottom half with a deal of some sort. But when you start talking about niches like this, sleep apnea or even implants or dentures, you can use them with success. And actually, I believe what we did with Kent and some of our other clients is we did both.
Right.
We targeted the areas around the practice geographically with postcards, and then we also did a full-blown brochure piece that got into the subject with a lot more depth.
When Kent first started with his partner, it was just family dentistry, and we did everything we normally did, and they built up to a certain point where we created what's called a senior mailer. Yeah. And for the folks who listen to these podcasts all the time, you'll know that the last 2 podcasts were about promoting implants, and part of those podcasts mentioned senior mailers. Well, if you're going to do senior mailers and you're going to do sleep apnea treatment, what a wonderful thing to put in your senior mailer. Sleep apnea treatment.
Yeah.
Is what you're doing is you're doing age targeting, income targeting, credit score targeting. You're doing all kinds of targeting for these mail lists, and you're basically putting together 4 or 5 or 6 things that your dental office provides, services, technologies, and amenities you provide specifically for the over 45 crowd. And sleep apnea is a huge part of that. That doesn't mean that people who in their 20s don't have sleep apnea. It just means that people in their over 45 can recognize when their spouse is getting louder. Okay.
Yeah.
Okay. So,
especially when she moves out of the bedroom.
Right.
That's a good sign right there.
Yeah. Or they've been diagnosed. They've been to a sleep center. They've been to a sleep MD. And they've been diagnosed with sleep apnea, and they have their CPAP. And if you put a picture of a CPAP in front of somebody who uses a CPAP, and you put that little circle with the slash through it in red, you're going to get their attention, because they would love to have anything else other than a CPAP. And honestly, so would their spouse.
Yeah.
Because if you've ever slept with somebody with a CPAP, here's what it sounds like. All flipping night, right? Yeah. So it's kind of like that clock with the tick, tick, tick. That's like the only thing you hear. That's your head just starts to explode after a while.
And even if a person is already hooked up with a CPAP and you've got that going on, they're willing to give it a shot,
right? Exactly.
To this mouth guard thingy.
Yeah.
If there's any possibility they can ditch their CPAP. Now, a lot of them can't. If you're right. If you've been diagnosed with severe apnea, then okay, the CPAP's the gold standard, and that's what you need to do. But anything less than that, a sleep dentist can help a lot.
A lot, right? And so part of the marketing is also, your professional network, right? And I'm sure Kent will, he ran into sleep MDs who were concerned about what he was doing, and he ran into sleep MDs who were willing to listen. And then he ran into sleep MDs who are willing to understand. So it's possible in your market, you're going to have sleep MDs in each one of those categories too. And if you run into 2 or 3 of them that slam the door in your face, don't get discouraged. Keep looking, keep talking. Maybe have a wine and cheese. Maybe do your own seminar. Maybe whatever you can do. Go to their local. They have study clubs just like you do. But your professional network is going to be really important as well to get this off the ground, because you're going to need a place to take these people who are undiagnosed to get a diagnosis to a sleep MD who's not going to just instantly put them in a CPAP.
Yeah.
Right? Okay. Yeah. Someone who does also understand that, yes, we can solve this problem with this dental device and you won't need a CPAP, and a place for them to refer their CPAP intolerant patients, of which there are many. Okay.
Yep.
So another thing you'll need to learn or outsource is medical billing, because these are all, most of these are covered under medical. So
not dental insurance, medical insurance.
Right. So you'll need to either learn how to do it yourself or outsource that to a firm that does. So there's a lot involved with sleep apnea. Promoting it, though, hasn't really been an enormous challenge. Normally, maybe some Facebook boosts, a senior mailer campaign, and every once in a while a PPC campaign, Google AdWords. But normally that's pretty much going to max a dentist. There's very few dentists out there who are like Kent Smith, who are going to say, you know what, I'm going to close, my operatory doors to everyone but 6 month smiles and sleep apnea. I mean, probably only 5 of those in the country.
Yeah.
But there are lots of dentists out there who really feel the same way Kent does, and they really want to help people, and they really want to take the time to learn this, and they really, they get personal satisfaction out of really helping these people, right? So, in order to do that, I mean, it's really the same thing that we talked about in our dental implant podcast. You always start with your existing patient base. You don't have to do anything external to the practice. Maybe put a page about sleep apnea on your website, but that's not a big deal, right?
Yeah.
Have some brochures, or have an internal loop in your reception area, talk about sleep apnea and the possibilities. Maybe talk to your patients, especially your patients who are over 45, and ask them if you have husband and wives that come into your practice, which I'm sure all of you do. You might mention to Mary, hey, does Doug snore? Well, of course Doug snores. Doug snores, right? And you look down at his airway. I mean, you're sitting right there. You can see there's no room. You say, Doug snore? Yeah, Doug snores. It's a pain in the ass. Okay, well, we might be able to help you out. And that's the way you start a sleep apnea part of your practice, from your existing patients. And then you go outward with your advertising from there. So.
I think also what was extremely helpful, according to Kent, was we filmed him. We brought him here in Vegas, I believe, and filmed him and put a video up on his website where it was just him talking to the patients, whether they were his own patients or brand new people, and that does a lot to kind of dispel any nervousness, or get, and also to give hope to the people that are just at their wits' end with this whole sleep and snoring business. So you might want to consider that too, even if you do it yourself, but get something up on your website.
Yeah, it definitely humanizes the connection between the dentist and the potential new patient. It absolutely does that. And it's not really just for your website. You can use that for your social media properties as well.
Oh, yeah, absolutely.
Another thing we can tell you is, if you are going to do sleep apnea and you are going to have a website and you are going to have online scheduling, don't forget to put a sleep apnea consult as an appointment type on your online scheduling, because these people, I don't know how many appointments I got through. I don't know. 75 appointments came into my inbox over the weekend. so not just for sleep consults, but our clients who do sleep or do implants or do any niche, really, Invisalign, what have you. If you're going to have a website, you're going to have online scheduling integration, you got to have, don't forget, here's my point, don't forget that, okay? Because it's easy to overlook. And then 6 months later, you go, smack my head moment. And then you end up putting it on there. And then all of a sudden you end up with sleep apnea consults. It's amazing how that works. Also on the online scheduling portal, put it on, how it has new patients or established patients appointment types. Make sure you put it on both, because your established patients are going to start getting really used to using the online scheduling, and you're going to want them to see that the office can help them with their with sleep apnea. And actually, it'll cause questions. They'll come in and they'll say, I was making my appointment online and I saw this sleep apnea consult. What is that? All of a sudden, you get questions. You get a lot more questions about the things that you're trying to promote, right? Just from your own established patients at no additional cost, which is always good. So,
great.
So that's good. We got to, hopefully we'll have another legion of sleep apnea dentists out there helping people save their marriage and helping people not die.
Yeah, right? Exactly.
That's always a good thing.
That's always a good thing. And, of course, it's pretty obvious you're going to have to get some training in this. And I know Kent offers courses. I don't happen to have his URL here, but just Google him and find out where you can go to learn about this. And it's a good thing. It's a good service.
Yeah. Anyway, if you just Google Kent Smith.
Yeah.
Dr. Dentist Kent Smith.
Yeah.
I'm not even going to spell it for you.
All right, ladies and gentlemen, thank you so much for tuning in. And we will be with you shortly, probably next week.
Bye-bye.
Bye-bye.
We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and newpatientsinc.com.